you so much for taking the time out of your busy schedules to come to this ExChange webinar. So I'll now introduce to you Laura Cowley. She is a research officer and data scientist from Swansea University. And she is going to talk to you about a very fascinating study carried out as part of the Family Justice Partnership about understanding the care pathways and placement stability for infants in Wales. So without further ado, I'll pass you over to Laura now.
Hi everyone. I'm going to be presenting today some new evidence about entry routes to care, pathways through care and placement outcomes for the very youngest children in the care system in Wales. This will be the 7th report in the Born into Care series and the first to use data collected by local authorities on all children in care to understand the care experience and outcomes for infants less than 1 year old. And this will be published as a long report and also as a summary report in the next few months. So the summary will be able to be accessed from the Nuffield Family Justice Observatory website, and the longer report will be available from the Population Data Science website at Swansea University. So just to give some context then on the legal context of care entry in Wales. So when a child is identified as having suffered or is at risk of suffering significant harm at the hands of a parent or caregiver, the local authority may issue care proceedings under Section 31 of the Children Act 1989, and then the child may become the subject of a care order at the final legal hearing. And children can also enter the care system on a voluntary basis, whereby the local authority accommodate the child under Section 76 of the Social Services and Wellbeing Wales Act. So there's two primary routes into the care system, and a proportion of children who enter care under voluntary arrangements will also then go on to experience care proceedings as well. So far, the Born into Care research has focused on data about infants coming into care via care proceedings under Section 31. And this is captured within CAFCAS and CAFCAS Cymru data. So CAFCAS is the Children and Family Court Advisory and Support Service in England and Wales, respectively. CAFCAS and CAFCAS Cymru, I should have said. And their role in care proceedings is to make sure that local authority arrangements and decisions for and about children protect them, promote their welfare, and are in their best interests. However, the CAFCAS data doesn't capture the voluntary accommodation of children under the Section 76, and it also doesn't capture information on children's placements. And while there's a few notable exceptions, research on children in care in Wales has generally relied on sort of snapshots of yearly aggregate data provided by individual local authorities. So the Children Looked After data has recently been acquired from Welsh Government and anonymised and deposited into the secure anonymised information linkage data bank at Swansea for research purposes. So you can find out a little bit more about the data in this publication here on the ADR Wales website, but the acquisition of the data presents really exciting opportunities to explore children's experiences of the care system at the individual level and on a longitudinal basis. And I should have said that for those of you who aren't familiar, SAIL is a privacy protecting research environment that holds administrative data sources relating to the population of Wales. So we used the Children Looked After data in this study, which is data collected by local authorities and maintained by Welsh Government. We also linked this to the Welsh Index of Multiple Deprivation dataset to investigate the area level deprivation for each infant on entry to care. But relevant information from the Children Looked After dataset included their week of birth, gender, ethnicity, their lower layer super output area, which is based on postcodes, and what allows us to link to the deprivation quintiles. And then there's the start and end dates of each episode of care, the legal status, the category of need, the reason the episode started and finished, the placement type at each episode, and the local authority. So in terms of the population and the time frame that we chose, so we looked at all infants in Wales who were aged less than 1 year and who entered care between the 1st of April 2003 and the 31st of March 2021. And this sample was used to quantify frequencies, calculate incidence rates for all infants entering care for the first time over time. And then a second sample included a shorter time frame, basically. So this was chosen to allow for a 2-year follow-up window for all of the infants who first entered care during this period, and allowed us to examine changes in legal status and also placement outcomes as well for the children. So I'm going to present quite a few of the key findings from the report. I'll take you through each one. And the first finding really is that there's rising numbers of infants entering care across Wales, but there are also significant regional variations. So the number of infants entering care for the first time has been increasing since 2003. So in 2003, 230 infants entered care, but by 2021, this was 353, so a total increase of 54%, although we did see fluctuations in the intervening years. And in terms of newborns, we referred to newborns as babies who are less than 2 weeks old, and newborns represented the largest proportion of infants entering care for the first time in each year, and represented 38% of all infants entering care for the first time during the study period. And if you take infants who are under 4 weeks old, then they represent 45% of all infants entering care over the 18-year observational window. So incidence rates actually provide a clearer picture of the likelihood of infants in the general population entering care. And these are expressed as the number of infants entering care per 10,000 infants in the general population. And you can see here that the highest recorded incidence of infants entering care for the first time in Wales was 141 babies in 2018. And by 2020, the incidence has declined slightly to 120 per 10,000 population. But overall, this is up from 74 in 2003. So overall, it's looking like infants in Wales have been increasingly likely to enter care over time, despite the fact that population estimates for infants have been declining since 2012. So it would be quite interesting to see here what's happened beyond sort of March 2021 throughout the pandemic. Interesting to see if that's kind of stabilized or started to go down or back up, but we didn't look at that in this study. So this is a funnel plot of the incidence rates of infants less than 1 year entering care by local authority. And the way to read this plot is the yellow line plots the national average, while anything outside of the blue lines represents sort of considerable divergence from the average. So you can see here that there was quite considerable variation in the incidence rates of infants entering care between the 22 local authorities in Wales, with 7 local authorities having higher than average incidence rates and 9 local authorities having lower than average incidence rates. So we also looked at the relationship with deprivation, and we actually did this in 2 different ways. So the first way in which we did this is to plot the incidence rates alongside the percent of the local authorities' lower super output areas. So these represent small areas in Wales that are in the most deprived 20% of all areas. So the dotted line here shows that there is a link with area deprivation in that rates of infants entering care generally increase in line with increasing levels of area level deprivation. So The relationship does look a little bit complex and requires further investigation, but there is certainly a link there, and unfortunately this is nothing new and has been demonstrated in our reports before, in the some of the Born to Care reports, and also in other publications and analyses as well. And the other way in which we kind of looked at deprivation was to have a look at the proportion of infants entering care by legal status on entry. And the deprivation quintiles are shown here. Deprivation quintile 1 is the most deprived, and number 5 is the least deprived. And we also had some missing data here as well. But you can see here that there's quite a clear relationship between the rate of infants entering care and area level deprivation, regardless of the legal status on entry, which is quite significant. But again, we do need to take these findings with a bit of caution, because 20% of the sample were missing data on deprivation, and this was due to missing postcode information in the children looked after data. So we also had a look at variation in incidence rates between district family judge areas, as well as across the 22 local authorities. So this shows North Wales, and as you can see here, there was actually not very much variation between the local authorities in the North Wales area, with no outliers above the upper outer line, and only one, so Flintshire, below the lower outer line on the funnel plot. But this is a different story in the other areas. So this plot shows the variation between local authorities in the Cardiff and South East Wales area. So as you can see here, there is some variation between the incidence rates. So we've got Torfaen and Rhondda and Blaenau Gwent here appearing above the upper outer line, Cardiff and the Vale of Glamorgan having kind of lower than average incidence rates here. But in general, the sort of dots are dispersed around the plot, which highlights considerable variation. And then, as you can see here, this shows the variation between the local authorities in the Swansea and South West area, and there's even more variation here in the incidence rates of infants entering care. So the regional average here was 108 per 10,000 of the population, but none of the 7 local authorities fell within the expected boundaries of this. So a few had higher than average incidence rates, and a few had lower than average incidence rates. So in terms of ethnicity of the infants entering care, you can see here that the ethnicity of infants entering care on the left over the whole study period appears to be similar to the ethnic composition of all infants in Wales, and this data on the right is taken from the ONS ethnicity figures for all infants in 2021. So of all the babies entering care, 88% were white, while 3% were in the mixed ethnic group, 2% were in the other ethnic group, 1% were Asian or Asian British, and 1% were Black African, Caribbean, or Black British. But again, as you can see here, in our sample, we had 5% that didn't have an ethnicity assigned. So we need to be careful here, because obviously this category represents the second highest category out of all of these, and these are quite small numbers. So we just need to be careful when comparing these. But in general, I think the ethnicity does appear to be similar to the ethnic composition of all infants in Wales. So in terms of how infants have entered care, we can see from this chart here, so the different legal statuses that children are under when they enter care. And more than half of the infants entered care for the first time under a voluntary arrangement, so a Section 76. And then around 37% entered under an interim care order. Around 5% were taken into police protection as their sort of first experience of care. 3% had an emergency protection order, and then a smaller proportion entered care for the first time for respite reasons under short-term breaks or for other reasons which we think are probably data errors, but we've included there. So I should say then that the analysis following this will mostly just focus on the infants who've come into care via these four: the voluntary, interim care order, police protection or emergency protection. And this is because of the disclosure control principles that are as part of the sale sensitivity. And so in some cases, we were only able to look at voluntary arrangements and interim care orders. So basically, the analyses that follow are just based on slightly different sample sizes. So just something to bear in mind. So this shows the incidence rates of infants entering care by their legal status, again, per 10,000 population and per year. So it appears that the use of voluntary arrangements has actually been decreasing relative to the use of interim care orders. But by 2020 and 2021, the same proportion entered via both routes. So it seems to be sort of converging. And the brown line at the bottom here shows the incidence of infants entering care under either police protection or emergency protection orders. And this has stayed quite stable over time. And as you can see here, following sort of 2014, the use of voluntary arrangements started to decrease quite sharply, and the use of interim care orders started to increase. And we think this may be in part due to some judgments that were given around this time on the inappropriate use of voluntary arrangements for young children. So if we are looking at local authority of variation again, this is a little bit of a complicated graph, but basically this is again a funnel plot showing the incidences by local authorities, and on the left here we've got the incidence of interim care orders only, and then on the right we've got incidences of voluntary arrangements. So what this is showing really is that in the majority of local authorities, incidence rates of infants entering care under voluntary arrangements were actually higher than those of infants entering care under interim care orders. But where the incidence rates of interim care orders were higher, these were all in North Wales. And areas with the highest incidence rates of infants entering care overall also actually had the highest usage of voluntary arrangements. And interestingly, these local authorities were also among the most deprived local authorities in Wales. And you can see that there's considerable variation between local authorities in how they use voluntary arrangements, with all but 5 local authorities falling above or below the outer lines of the plot, indicating quite a lot of divergence from the national average. So what we've sort of taken from this is that variation in the use of voluntary and compulsory routes to care appears to be a matter of local practice preference, but the reasons for this warrant further investigation. And again, we've done the same thing here and considered the incidence rates by the district family judge areas. So as you can see here, in North Wales only, there is a higher incidence of infants entering care under Section 31, so under interim care orders, compared with infants entering under voluntary arrangements. And also North Wales had a considerably lower incidence of infants entering care under voluntary arrangements compared with Cardiff and South East Wales and Swansea and South West Wales. And again, we'd need to do further work to unpick why this might be. But we are seeing differences in entry routes to care, which actually most likely reflect different cultures of practice in different local authorities and district family judge areas. So here we have plotted the proportion of infants entering care by legal status against the category of need that they have come in on. So in the majority of cases, as you can see here with the dark blue, the reason given for the entry to care was described as abuse or neglect. There was some variation here in that a smaller proportion of infants who entered under voluntary arrangements were described as entering because of abuse or neglect, compared with about 79–80% of those entering under an interim care order or police protection or emergency protection. But overall, the findings are suggesting that local authorities vary in respect of which entry routes to care they favour, rather than the differences actually reflecting underlying need or risk. So as you can see here, we've got 70% of children who have come in on voluntary arrangements. The reason that they have come into care has been because of abuse or neglect. So we also looked at when children entered care under voluntary arrangements, how many also then go on to have court intervention, in other words, to have compulsory arrangements within a 2-year follow-up period. So for this analysis, we used the second sample, which was limited to 2019 in order to be able to follow all the infants up for 2 years. So between 2003 and 2018, 3,094 infants entered care under Section 76, and actually over 2/3, just under 2/3, or 63%, subsequently became the subject of a compulsory order within 2 years of entering care. And when we consider newborns separately, that proportion is slightly higher at 70%. And often the conversion from voluntary to compulsory arrangements happen quite quickly. So in 43% of cases, care orders were made within 4 weeks for the whole sample of infants, but when looking at newborns separately, this rose to 53%. So overall, it's looking like newborns who enter care for the first time by way of voluntary arrangements are more likely to then become subject to compulsory action than slightly older infants. And as well, for this age group, care proceedings tend to be issued more quickly and conclude more quickly from interim care order to care or placement order. So looking at these trends over time, we can see that particularly following sort of 2014, 2015, far more infants who are initially subject to a voluntary arrangement have then become subject to an interim care order. So this is showing the proportion of infants who initially come in via voluntary care, who then go on to get a court order. And we've plotted this against the length of time, or the mean length of time taken for the order to be made in days. So as you can see here, the number of days between voluntary arrangements and the receipt of an interim care order is actually falling over time. So this means that we've got more infants entering care under voluntary arrangements that then have court intervention, and the time taken for the court intervention to happen has decreased. And this is looking again at local authority variation, and we have plotted the percent that were subject to an interim care order following a voluntary arrangement against the time taken in days to receive this arrangement. And again, we can see kind of considerable variation here in terms of both the proportion of infants who became subject to an interim care order and the length of time that it's taken to get an interim care order after entering under voluntary arrangements. But there doesn't really appear to be a clear relationship between these two factors within local authorities. It appears to be quite random. So, for example, Flintshire has the highest proportion of voluntary arrangements who escalate to formal court intervention, and it appears that they take a very short amount of time to do this. this differed quite considerably for local authorities. And we can also see here again, we have plotted the proportion of infants entering care who did and did not become subject to compulsory action against their category of need codes. And while there were more infants in care because of child or parental disability or acute stress within the family in the group who did not become subject to compulsory action, we can still see that voluntary arrangements are still being used for infants who are in care because of abuse and neglect. So over half of infants who didn't become the subject of compulsory action actually entered care because of abuse or neglect, which we've interpreted as local authorities kind of managing risk through voluntary relationships with parents that do not then ultimately escalate to court intervention. So looking at placement types for infants on entry to care by age, it appears that for newborn babies, immediate separation from parents and family is the outcome in the majority of cases, regardless of the route into care. So we can see here that a greater proportion of newborns were initially placed with unrelated foster carers in a mother and baby unit or in a residential medical setting. And a greater proportion of older infants were placed in family or friends foster care or with their parents. And only a quarter of infants who were placed with their own parents or with kin were newborns. So regardless of the route into care, newborns appear to be separated from their family in about 75% of their cases on initial entry to care. And looking at placement types on initial entry to care by legal status, you can see here that the majority of infants entering care under an interim care order are not placed with their own parents. So we found that around 15% of these children were placed with their own parents. So they had a care order at home, basically. And the majority of infants who entered care under voluntary arrangements were also placed with unrelated foster carers, and only 16% of these children were actually placed with kin, so with family or friends. We also found actually that the route of entry into care does appear to influence the placement outcome at 2-year follow-up. So again, we've only followed up the infants for 2 years, so we only know the outcome at 2 years. But within 2 years, 60% of infants who'd entered care between 2003 and this was 2019 had then left care. And of those who'd left, over half who'd entered care under voluntary arrangements had either returned home to their parents or returned to family with a special guardianship order, compared to just over 35% of infants who'd entered care under an interim care order. And conversely, just under 55% of infants who entered care under an interim care order were adopted, compared with just 35% who'd entered via voluntary arrangements. So we've interpreted this as the route of entry to care being associated with the final sort of permanency outcome for babies, really. And it appears that there's actually greater family preservation for those who initially entered care on a voluntary basis. So we also found that over 1/3, so around 37% of infants who entered care under voluntary arrangements didn't become the subject of compulsory action. And the good news is that 94% of those infants had actually left care after 2 years, and most of these had gone back to their parents. And there was only 6% of this group who were still in care at 2-year follow-up, and most of these were placed in foster care with unrelated foster carers. So it does look like long-term voluntary arrangements are used for a small minority of infants. So turning now to placement stability. we found that a significant proportion, so around 30% of infants less than 6 months had 3 or more placements within the 2-year follow-up window. So newborns were more likely to experience more placements than those who entered care when they were older. And looking at this broken down by legal status, we found that infants who entered care under voluntary arrangements actually experienced fewer placements than those who entered care under an interim care order. But based on these findings, we can say that infants appear to be experiencing quite a significant amount of instability. And it's infants who first enter care on a voluntary basis who record the lowest numbers of placement moves. And infants entering care under compulsory arrangements, around 30% of these have 3 or more placements. And this is within the 2-year follow-up period again. And it is worth noting that some moves are obviously planned for positive reasons, but unfortunately it does look like the very youngest babies subject to care proceedings, so newborns, actually record the highest rates of placement instability. And this has been found before in previous reports. It's newborns who are most likely to be subject to emergency or hasty decision making. And this might explain the number of moves in care, but these findings really reinforce the need for investment in the Welsh Early Permanence Framework, which aims to reduce the number of placements a child experiences and help them to achieve stability as soon as possible following removal from their families. We also found that a minority of infants actually left care within the 2-year follow-up window and then returned within the same window. So this chart is a Sankey diagram. So you can see here that most babies who left and then returned actually, so this is the route of their initial entry into care here, and this is their route of re-entry to care on the right. So most babies who left and returned had initially entered under voluntary arrangements, and then they've come back again under voluntary arrangements. And others have initially entered, for example, via an interim care order, left and come back via voluntary arrangements. Others were detained for child protection reasons and came back via voluntary arrangements. So even though this represents a minority of infants, we think that further follow-up and analysis of this small but vulnerable population will be really important to shed light on their longer-term pathways and permanency outcomes. So I've got a number of concluding slides, so bear with me because it's not quite over yet, but I think we can make a number of sort of summary points from this descriptive analysis which can be taken forward to policymakers. So number one is that we are seeing rising numbers of infants entering care across Wales, although there does appear to be significant regional variations. There is a clear relationship between the rate of infants entering care and area level deprivation. And as I said before, unfortunately, this is nothing new and has been found in previous reports. The ethnicity of infants entering care appears to be similar to the ethnic composition of all infants in Wales. More than half of the infants enter care for the first time under a voluntary arrangement. However, the use of these arrangements has been decreasing relative to the use of interim care orders. And by 2020, the same proportion had entered via both routes. So again, it would be really interesting to see what happened kind of after this, during, and then, you know, throughout the recovery of the pandemic. Local authorities do appear to vary in respect of which entry routes to care they favour, rather than differences in the use of entry routes reflecting that kind of underlying need or risk. And we do think it would be important to have a look at the category of need codes in more detail, especially because local authorities are only required to choose one category of need code. So, you know, this might reflect some of those findings there. Some more points just to summarise, so a majority of the voluntary arrangements become compulsory within 2 years. Over time, more infants entering under voluntary arrangements have become subject to an interim care order and a full care or placement order, and the time taken for these orders to be made has decreased. Voluntary arrangements were being used for infants who entered care because of abuse and neglect, but again, I think it would be valuable to do some more work here around the use of the category of need codes in different local authorities. We did see that long-term voluntary arrangements are used for a small minority of infants. And we also saw that for newborn babies, immediate separation from parents and family is the outcome in most cases, regardless of the route into care. And that also on initial entry to care, the majority of infants are actually placed with unrelated foster carers. The type of entry into care does appear to influence the placement outcome. And while these are tentative findings, it does appear that actually if you enter via voluntary arrangements, you have more chance of being sort of reunified than with your parents in the long term. Infants do appear to be experiencing quite a significant amount of instability in their placements within the 2-year follow-up. With, again, a small minority who had actually left care and then came back again within the same 2 years, which warrants further investigation. Just to touch again on the significant variation in the use of the different legal options at birth across local authorities and district family judge areas. Again, we think that this is suggesting, these differences are a matter of local practice preference rather than a reflection of need. And local authorities with the highest volume of cases and incidentally the greatest level of deprivation have been making greater use of voluntary agreements with parents. So we've kind of speculated that voluntary arrangements may have been used as a way to manage high volumes of cases. But again, this hypothesis warrants further investigation. But we think it would be really insightful to do some qualitative work with local authority practitioners and family court judges. We're hoping that this might shed some light on the reasons behind variation in the use of the different legal options for young children. So by examining entry to care and change of legal status, as well as following up the children and their placements over 2 years, we've been able to categorise pathways for infants entering care. Bear in mind, this is just the infants who've entered under either voluntary arrangements or an interim care order. So this represents 5,077 infants. But we've been able to categorise the pathways of this sample of children as follows. So the first pathway represents 22% of these children, and these are infants who enter care under voluntary arrangements, and then they remain subject to voluntary arrangements as a family support service. So that's about 22%. We've got 39% of the sample appear to be entering care with voluntary arrangements, and then they become subject to care proceedings. And this typically happens, as we saw before, within around 4 weeks. The third pathway appears to be infants who enter care via care proceedings, and then they're placed straight away in out-of-home care. And then the fourth pathway is the kind of small group of infants who actually enter care via care proceedings, and then they're placed with their parents on a care order at home. So just to conclude, so this study is based on the total population of infants entering care in Wales over an 18-year observational window, and as far as we're aware, it's the first to examine both entry to care and change of legal status beyond initial entry to care. And infants who first enter care via care proceedings and who are not placed with their parents have a greater chance of being permanently separated from their birth parents and extended family compared with infants who first enter care under voluntary arrangements. However, this is a descriptive study, and a neat split between voluntary and compulsory intervention is not evident from the data. Rather, there's movement between the two legal statuses, and furthermore, evidence of care proceedings used as a mechanism to support and preserve placement with parents. The variation between local authorities does warrant further analysis. Basically, adaptations in practice might be considered a positive response to the combination of factors that need to be managed at a local level, including need, resources, and preferences of local adjudicators. However, it is clear that the mode of entry to care does matter alongside the initial placement type. So I would just like to acknowledge the wider Family Justice Data Partnership team, which is a collaboration between Swansea and Lancaster, and all my colleagues, and also colleagues at the Sale Data Bank, Welsh Government, ADR, and also, of course, the Nuffield Family Justice Observatory for funding and general support. And I'm happy to take any questions. Thank you.
Thank you, Laura. That was a really insightful piece of work, and the presentation was great. There's lots of findings for people in the sector to mull over. I found the summary of the pathways at the end really nice and helpful to bring all of what you've just shown us together. So thanks for that. So I'm going to go to questions. So there are a few comments in the chat, but if people have any more, you can keep adding to the chat, or you can put up your hand and you can ask your question verbally. So I'll just start. The first one is just a comment from Julie, just to say that the three DFJ court areas referred to in the last slide, so these were near the beginning, they are designated family judge areas, not district judges. Each of the three areas have several judges and magistrates making these orders. So that's just a little comment there. Francis has a question. Were any of the voluntary arrangement babies who were relinquished? So I think were any of those babies who were on voluntary arrangements given up, or can you find that out from the data?
I think we might be able to, but I don't think I looked at this. I've done this analysis quite a while ago now, but I think you probably could look at that. But
Okay.
yeah, I think I did look into this at one point, or start digging into it, and there were very few that were relinquished in general. So
okay, that's helpful, and maybe that will be in the massive report that that's going to be published soon. So Linda has a comment saying parental engagement is key to any voluntary arrangement. And then she went on to say, was the circumstances of the parents explored?
I'm not sure what you mean by circumstances, but as this was a study based on data, we weren't able to identify any of the families, or obviously, or it was a study using linked data, and there's not really any information about the circumstances of the families within the data, unfortunately. So
okay, thank you. Karen says, thank you, most interesting, especially the lack breakdown across Wales. Nikki has a question. Was there any correlation between staff stability, in brackets consistent social worker, and infants returning home, or was this not explored?
We weren't able to explore this within the data. There's no information about social workers, unfortunately, within the CLA data.
Okay. So Linda has actually elaborated on her comment. How many parents were vulnerable due to drug use, etc.? Were you able to find that out?
Okay. We definitely can find that out, and it would be something that we would be interested in exploring, definitely, as part of a larger project. So we can link the parents to their sort of mental health and substance use and domestic violence, for example, data. We didn't do this as part of this descriptive study, but it's definitely something that you can do, and we would be looking to do in the future.
Yeah, I agree. I think that would be a really insightful piece of work to continue this on. So there's just been a couple of comments just to say that the number of relinquished babies recorded in local authority data is very small.
Yeah.
Jonathan would like to comment if it's possible on the need for additional qualitative research. Yeah, I think you maybe mentioned that in one of your last slides, didn't you, that qualitative research would be good.
Yeah, definitely. I think it would be really, really interesting to explore the use of voluntary and compulsory orders across local authorities, and would be able to kind of complement some of the insights that we've been able to get from the data. So yeah, I'd be really interested in following that up and doing a qualitative study.
Yeah,
Can I say
great.
something, Sophie?
Yeah, go for it.
Yeah, just to back that up, really. Thanks, Laura. Really, really interesting. All of what you said was really interesting, and I agree with you. You know that qualitative research needed, because on the face of it, looking at this, if you like, from the outside, it seems incredibly surprising that so many children went into care just after being born on a voluntary basis. It seems implausible, doesn't it, on the face of it, given that Julie Doughty says there that actually the number of relinquished babies is very tiny. So you wonder, obviously, is this being used in a different way? Is it being used because it's quicker when staff are under a lot of pressure with large volumes of work? But I mean, there is a real natural justice issue there, isn't there, of parents perhaps being persuaded to put their children in care and not having the chance for that to be actually heard in a court, the arguments to be actually heard in a court of law. So yeah, definitely need to know more about what's happening, don't we? But thank you, it's really interesting.
Thanks.
Great, thanks for that, Jonathan. I can't see any more comments or hands up, but I had a couple of questions for you, Laura. So were there any surprising findings for you?
I was quite surprised by the quite stark difference between the designated family justice areas. Sorry, I did get that word wrong. It is designated, as someone pointed out, not district. But I was quite surprised in the difference between North Wales and then the other two areas. So I think it was let me see. Yeah, this graph here, it just shows like quite a stark difference in the use of voluntary arrangements and interim care orders, really, between the areas. And again, something that we could try and unpick with qualitative work. But when I kind of plotted that, I did go back into the data just to check that was, that was all correct, because it does obviously look like quite a difference in the use of voluntary arrangements in that area.
Yeah, no, that is now you've pointed that out, that is quite a difference, isn't it? Yeah, definitely needs some further work there. And another question, so Julie just says, I agree that the difference in North Wales is startling. Does anyone have any comments on that finding? If you'd like to raise your hand or turn your mic on, then we could discuss that further. If not, I have another question. Doesn't look like anyone wants to say anything, so that's fine. So the next question I had was, what are the next steps for this research?
So at the moment, so obviously this was quite descriptive. So at the moment, I'm also working on a sequence analysis of the placements. So we've taken all the infants who've entered care between 2003 and 2016 to allow for a 5-year follow-up, and we are doing a sequence and cluster analysis of their placements over a 5-year period to try and determine if there are any patterns in their placement trajectories. So that's obviously using kind of statistical methods on top of these descriptive findings to try and look at patterns of placement trajectories for vulnerable children coming into care at such a young age. So that will be completed soon and hopefully published. And then I'm just starting this week a fellowship looking at predicting risk factors for care entry, placement instability and care re-entry for all infants in Wales, all children in Wales, not just infants. And this is going to be a 3-year project. So that will build on this work as well. And as I say, I've got that project going now, but I'd be really interested in taking this forward for qualitative exploration as well. I think I think it's really important to complement these data insights with qualitative work. So I don't think we can just leave it as it is. We need to find out what's going on. So while we haven't got any immediate plans to do that, yeah, I think it would be great if somebody took that forward.
Anyone? Any takers? No, that's great, and I completely agree. The data is obviously really important, but we just need to do some more unpicking there, don't we? And your fellowship sounds so interesting. So look forward to hearing more about that in the future. So I think that's all for today. Thanks everybody for coming, and really appreciate you, Laura, as well, taking the time to come. So thank you, Laura, and everybody.
Thank you very much.